Hey guys, it's Gary Peterson. I'm just going to do a quick review for you with the BIG, the bone injection gun. Now, what you might be more familiar with for an IO is going to be the Easy IO with the driver and the needles. But this device, is a little bit newer on the market. I really like it. We saw it at a trade show, at a demo, and it's, in my opinion, easier to use, less expensive, considerably less expensive than these, and it doesn't have a driver that could possibly fail on you. If you've been doing calls a long enough time, then you have definitely been on a scene where this battery just quits on you. Yes, you can still continue the IO with a hand drive, a hand push, but that's much more uncomfortable for both the provider and the patient if they're conscious. So this is the BIG. Pretty simple. This is the trainer device. I'm going to show you guys what it looks like in the packaging. For those who ride with us, you've got your standard med bag, and on the side where we have our IV supplies, if you were to have to put in an IO, this is your device. It's right here in the packaging. All you do is peel it open, and you will end up with this device in your hands. Same kind of thing on the other side. We open up. We've got the pediatric one. It's a different color, and it's marked pediatric really big in red. What you'll notice that's a little bit different is that when you turn it over, you see the numbers 6 to 12. Now, this one has a threaded tip. So as you unscrew it, it's going to go down to ages 3 to 6, and then farther down 0 to 3. That puts a little bit more distance between the target and the driver, and it'll put it in automatically at the correct depth. So what you're used to with the regular Easy IO is having to drive until you feel like the lack of resistance, where you've gone through the periosteum. The BIG doesn't require that at all. You literally just pull the safety clip, and you are going to push it and drive it just like the old-fashioned hypodermic needle. So we're going to go ahead and bring this down closer to our practice target. And there you go. So this would be our bone. We're going to clean the site as we normally would. And then come down here on your level. So we're going to go ahead and clean this. This is about the only downside is that this is now kind of live fire. The trainer has not as strong of a spring. The live one has a stronger spring. So if I were to fire this, it would go across the room. So it is a projectile hazard. So you always keep it pointed in a safe direction. But pretty much you're just going to, that's about the only downside compared to the Easy IO. So clean your site, set it down, and simply done. You lift this off, and your outer shell is in the bone, and your inner core simply comes out, goes into a sharps container, and this little device, like your little grenade pin, actually becomes your stabilizer, which is kind of a cool thing. I find it easier to put your finger in there and spread it open a little bit as you go across here, but simply you just come across here, put your finger in, spread it, get inside that little notch right there, and two pieces of tape. Boom, boom. That thing is ready to go for aspiration and then flow. So positives: a lot simpler, less expensive, faster. Negatives: it can actually injure a care provider if you were to fire it at them. It is in fact going to give you a puncture. This one's never going to if you just clip it onto the magnetic tip. Unless you accidentally jab it into someone, it's never going to hurt them. So that's pretty much it. That is your bone injection gun. This is the adult one, the blue. If it were pediatric, you would just screw the tip down to the right size age range or approximate age range for physiology, and go ahead and insert it identically. This one is cleared for humeral head as well as tibial tuberosity, but not medial malleolus, and of course not for sternal insertion either. This one is cleared for tibial tuberosity only, but really that makes sense because you're talking about a target area. So can't use it in quite as many sites. That's probably another negative, but on the whole, I like it. And I hope you guys have fun. Feel free to step down and have a hands-on demonstration. But for a quick review on what to do and what not to do, you can reference this video. Have a great day.